My name's Danielle Cragg. I'm one of the MS specialist nurses, and today I'm going to show you a video of how you might use the MS Trust decisions making tool to aid you in decision making when you've received a letter from the MDT or received a letter suggesting any disease modifying therapies. So here is an example of a letter you may receive after being discussed at an MDT meeting, deciding on what medications they think would be best suited to you and that you are eligible for. So just scrolling down for the letter here, there are two medications that are listed on there, one of them being Kesimpta and one of them being Ocrevus. When you get a disease modifying therapy letter, it does list the medication and a paragraph about the medication. These can be slightly overwhelming, as you can see, there's quite a lot of text on there. When you receive a letter, it usually says you may liaise with your MS nurse or for us to get in contact with you. It's different with everybody and it should say an action at the end of it. I'm just going to show you now how you get onto the MS Trust decisions making tool. So you can go straight onto Google, so you don't need to remember the full web address, and click on MS Trust decisions making tool, and it's the first one that comes up. It will then bring you to the MS decisions page. Scroll down onto that and it says MS disease decisions tool, compare disease modifying therapy drugs. So I would click on that. And then it gives you examples of all the different medications you may be offered. So what the best thing to do is to click the medications that you may have been offered. So I want to compare Kesimpta with Mavenclad. You then scroll down, so you've ticked them both to compare. Click on the compare. And as you can see now on here, that they are in two different tables, which makes it miles easier for you to digest the information and have a look at different examples. So how you may take the medication. So for example, of this one, we've compared a tablet form medication with a self-injectable medication. It goes through how much monitoring there is, how effective the medication is, so you can compare these together, and then side effects and any additional information on there. It just makes it a lot easier for you to be able to break down these so that you can have a look between them both. And then usually some patients write down any questions that they may have and then discuss this further with their MS nurse if they have any further questions to ask.